Hi, this is the final exam presentation. Uh, it means to scrape hard material or peel off scales. In other words, it is also called calculus removal, reattachment by physically removing the hard deposits or soft deposits attached to the natural teeth or artificial teeth in the oral cavity to reattach a preventive technique aimed at preventing it. Even if you brush your teeth regularly, impurities are stopped. Of course, unlike the past, today, toothpaste, toothbrush, as well as various tools such as floss, interdental brush, and mouthwash have made tooth care much easier. So it's less serious than it used to be, but it still retains impurities. Even if you manage it tightly, such as gargle and floss every day, you can only slow down the buildup, but you can't stop the buildup itself. And these impurities are not a problem in themselves, but due to the additional problems that these impurities drive, they can adversely affect the teeth and gums. So this must be removed with a dedicated instrument, which is scaling. Usually, they are tested every 6 months. A person who has a lot of plaque attached, such as a smoker, should have a period of 3 months, and a person who has good brush and good oral hygiene should have a period of 1 year. At a young age, where cavities are prone to occur, a 6 month checkup is performed. In the case of regular dentists, if the patient is taking care of his teeth, he will change it every 1 year at the doctor's discretion. If you are the first person to be treated for the first time, you may see some coals sticking out of your gums. After the procedure, the quality of bad breath changes. There are many people who are reluctant to physically change their teeth that do not reappear once they have grown up, and they have to be treated frequently, but these people also do not give a different opinion on the difference in bad breath. As mentioned above, there is a misconception that teeth are shaved during the scaling process, which is different from the fact. Even if you find a video that scales right now on YouTube, there is no scene where you can drill your teeth. You can only see the scene of breaking out the tartar with a vibrator-like device. Of course, from a scaled point of view, it feels like you might be mistaken for grinding, but it's not changing your teeth. Scaling never changes your teeth. With the strength of the calculus removal equipment, the teeth cannot be removed. The reason for the slight pain during treatment is that the plaque builds up and solidifies, and it is affected by the process of forcibly removing what was affecting the gums. During the scaling process, only deposits such as tartar are removed, and the teeth are not damaged. And as mentioned above, tartar is a material that gradually builds up over time. The difference in strength from teeth that have already been firmly completed over many years cannot be compared. So the scaling tools are made to come out with just enough power to remove only the tartar. When manually scaling, the instrument is also used in the area where the gums and teeth come in contact with each other to remove the plaque. If the instrument is operated at a strength sufficient to grind your teeth, the gums will be split together. Ultrasonic scaling. The most known scaling used by dentists with water coming out with ultrasound. To remove the water, use a suction, and sometimes you can swallow the water by moving the tongue incorrectly. So you should cover your throat with your tongue and breathe only with your nose. If you want a lot of water under the judgment of the dental hygienist, you can remove the scaling device and close your mouth. If you close your mouth as instructed, you can quickly remove water with suction. According to the dentist, if the dental hygienist is uncomfortable before starting, raise your hand. But if you raise your hand in the middle, the appliance will be removed. It is also possible to remove tartar from pet dogs. Hand scaling. Using a cycle used to remove gingival calculus and the collet used to remove subgingival calculus. Ultrasonic scaling is used to remove the plaque in the nailing position, and it is accompanied by the fact that ultrasonic scaling is not effective in removing plaque. In addition, ultrasonic scaling may be performed in parallel because water may come out and it may not pass through calculus that has not been soaked in water. In many cases, dental hygienists take care of themselves. If there are many calculus after treatment, the area near the teeth and gums may be empty, or there may be holes that are missing between the teeth. This is because calculus stimulates the gums and the gums retract. Brush more often and get regular scaling. Correct brushing is done by brushing the teeth between the teeth and gums. In fact, the pain in scaling is because you are trying to clean the teeth and gums. In the case of bleeding from the gums during treatment, it is a swelling, which means that the location of the plaque is closer to the gums rather than the lack of doctor's skill. If the gums are in a healthy state, even if they are touched with a calculus removal device, there is rarely a lot of pain and bleeding. However, since the gums are already inflamed in the state where the plaque is quite accumulated, even if you touch it slightly, it hurts and the blood is irony. In other words, it's your fault that you haven't done this properly. The dentist has nothing wrong. Immediately after scaling, if you gargle with water and rest, the pain will go away quickly and the bleeding will stop immediately. However, depending on the person, this may or may not occur after a scale. This is end of the presentation. Thank you.